Hello, thanks for sticking around. In this section, Peak Performance, the Woundwire has decided to recognize select and special people in the field. The 2012 recipient of the Association for the Advancement of Wound Care's Distinguished Member Award is Kathy Milne. Kathy was awarded this honor for her work on the AAWC Quality of Care Task Force and for her collaboration with individuals who define interdisciplinary cooperation. Her unique perspective during task force discussions greatly contributed to the highest quality work product. The AAWC Distinguished Member Award is selected by the AAWC Awards Committee and approved by the AAWC Board of Directors. The distinguished member is someone who has selflessly given an abundance of time and talent to the AAWC, which has resulted in significantly moving the association forward. This prestigious award is often called the John Boswick Award, in the namesake of the first recipient of this award. Dr. Boswick was recognized by the AAWC for his contributions to wound care and the establishment of the AAWC. Dr. Boswick was the driving force in all areas including education, clinical practice, research, public policy, and international initiatives. The Woundwire would like to formally recognize and congratulate Kathy for her devotion and dedication to wound care, and as the 2012 recipient of this wonderful AAWC accolade. Kathy, welcome to the Woundwire.
Good morning, Dr. Niezgoda. Thank you very much for having me.
It's my pleasure, and we are so happy to be spending a few minutes with you here. Kathy, for those of you that don't know you as I do, tell us a little bit about your background, your training, your practice environment. Just give us a little quick nutshell on who Kathy Milne is.
I am currently an adult nurse practitioner and a clinical nurse specialist, so I have a postmaster's from the University of Connecticut. I practice in a private practice with nurse practitioners and other advanced practice nurses, and we perform wound, ostomy, and continence care. We like to look at it as across the continuum. So we see patients in acute care, long-term care. We do a day a week at an outpatient wound center, and we will actually make house calls for those who are truly homebound. So we see the challenges of wound care from each clinical setting. It's amazing the challenges that we do see.
Well, it sounds like you have a very collaborative practice, and certainly that reflects the nature of this award, the collaborative nature of the award. Please tell me, how did you get started in wound care?
I had a wonderful mentor, although sometimes we forget that when we see and meet somebody that we don't look at them as mentors. This woman was a vice president of inpatient services at an acute care facility I was working at, and the ET nurse retired, and she handed wound care over to me, and I fought it tooth and nail. She was very difficult to work for. She wasn't mean, but she was difficult. She had very high standards, and I still today love her to death for having her vision in terms of mentoring me as I learned a new specialty.
Now, you see, if she didn't have those high standards, you wouldn't have the same high standards.
Absolutely.
Look at the influence she had on you. That's fabulous. Listen, if someone were new to the field of wound care, just starting out, either a nurse, any of the providers, what advice would you give to them if they're just starting out in wound care?
I think they need to seek out mentors. I think you need to seek out mentors in different specialties and different disciplines, because we all have a different take on how to manage a patient, and broadening your view rather than narrowing your view is so important for patient outcomes.
Yeah, no, I absolutely agree with that. Let's look at the clinical practice in general. What's one thing that clinicians can do to advance the field? If you were to think of one thing that they can do to really advance wound care, what would you say?
2 words: demand data.
Research. Yes, that's right.
Well, and I see that we're going from clinical trial data to more of comparative effectiveness research. That's the real world. Does it work in the usual clinical setting? And I think that's the data that we should be looking for.
Well, great. Kathy, listen, I want to just thank you so much for spending time with us here on the show. Again, on behalf of all the members of Woundwire, I can't tell you how pleased we are that the AAWC found you and awarded you with this prestigious. You are certainly deserving. You certainly exemplify everything in wound care that those of us that are practicing in this field should look to and amplify. You really are the standard for the practitioner that we all should strive to be. So, Kathy, congratulations on this award. And would you consider coming back on the show at some later time and maybe share with us some clinical insights that you might be having in your clinic?
Absolutely. I would love to join you, and thank you for having me today.
You're certainly welcome. Congratulations to you, Kathy. Thank you so much. Stay tuned to the next segment.